From James Craig. Dr. Robert Weaver is the clinical director of one of these new primary care networks, which includes 5 practices. This is on the Mendips. Morning to you, Robert.
Good morning, Claire.
What are you doing now then, or what will you start doing now that you weren't doing before?
Oh, thanks for having me on your show. What we're actually going to be doing, I would actually say that there won't be a huge change at the individual practice level. Because I have heard some concerns from patients that perhaps there will be less appointments. It's actually going to be the opposite. On a wider level, we're going to be working together with the 5 practices to improve patient care, and that is actually going to be a really good thing for patients. There will actually be more options for patients. So one of the things that we can do is employ more staff on the network level, so a patient might be able to see, for example, a physiotherapist straight away, instead of waiting, a couple of weeks to see a doctor. And also across the 5 practices, we will look at ways of improving individual care through sort of projects, looking at cancer care, prescribing safety and things like that. So we're going to be meeting as a group to learn from each other. And I think it's all about making primary care more resilient, because we're all feeling the strain as GPs in Somerset. It's a challenging time, but I think this is a really positive way to make better relationships with neighbouring practices and become more resilient in a way.
Okay. How do you reassure people listening that the prospect of not seeing their GP as frequently, dealing with other staff instead, how do you reassure them? Because to many, saying that, well, actually, fewer patients will see a GP, that can seem unsettling.
I can see that, yeah. I mean, I would say that's just one example of something that could be done, but because this is actually a national contract, so these networks are being formed across the whole country. But the real important thing is that GPs are in the driving seat. So I'm a clinical director, but I'm actually a GP. I'm a partner at Grove House, and I think I will have a say in how we actually design the service. So if it's actually that patients would prefer to see a GP, then my plan is to listen to those concerns and make sure we design that service appropriately. Okay. So it's not about actually hiding GPs away or anything like that. It's getting the right care to the right person. So a physiotherapist, it would be much better at dealing with a young person with an acute back problem or something like that, for example.
How will you know if this is working? Are we talking about better waiting times and more time for GPs to spend with patients?
I think waiting times will be one measure. I think also one of the key things that the primary care networks aims to do is to try and keep patients from unnecessarily having to go to hospital, because that's just not a place that is a good place to be if you don't need to be there. So we're going to be working as a group across the whole of Somerset as well, to be a better part of the health and care strategy in Somerset. That's called Fit for My Future. So the aim of that really is to, I think as primary care networks, we're a combined voice for that system to talk to, rather than being these individual GPs that it's sometimes quite hard to communicate with GPs because we've got our heads down in individual practices. So as a clinical director, I'll be a point of contact for those 5 surgeries.
Okay. Well, we'll keep in touch with you then and see how this goes. Dr. Robert Weaver, thank you very much for your time today.
Travel update. BBC Somerset.
Clinical Director of the Primary Care Network for the Central and East Mendips. Luke, how are we doing?